Today's Coping with Depression series, we are going to be talking about basic self-care strategies. As always, this web workshop video library series comes from the Counseling and Psychological Services Office located at the IU Student Health Center on the 4th floor. Our phone number is 812-855-5711. Today's video PowerPoint is going to function very similarly to any other video that you've already watched or any of our live web workshops. So what that means is it's going to take you about 35 to 45 minutes to go through this entire video. I do encourage you, feel free to allow ample time to pause the video if you need to take a break, but certainly to pause the video to fully go through and journal your responses to all of the videos. So what I mean by that is there's going to be plenty of journal prompts throughout today's PowerPoint. So what that means is you're going to be asked to pause and reflect on the different questions being asked. And I mean actually literally pause and reflect. Pull out a piece of paper and a pen or pencil and write it down. If you're not comfortable with that, journal that on a computer or on your phone. This will allow you to ensure that you have a chance to really think about the material being discussed in a very individualized and unique sort of a way to be able to hopefully allow you to get more out of this video in addition just to the material and the strategies being discussed. But today's Coping with Depression workshop series is going to focus on exploring and identifying our own depressive cycle and symptoms because it is a very unique and individualized experience. We want to understand what that looks like in general. I want you to question how the depressive cycle may be contributing to overall distress. Understand and identify basic self-care strategies as well. And there are certainly 3 other workshop videos that do relate to this Coping with Depression series that I encourage you to check out if you're wanting to explore beyond today's video. Now, as always, each of these PowerPoints always starts out with us being able to understand our own depression experience. And I like to do this with basically anything because mental health is so individualized. It looks different on each person. We have different triggers. We have different degrees and intensities to which we experience the symptoms. So it is vital that we have the opportunity to really pause and question, okay, what does depression look like for us? And how can an increase of basic self-care strategies help us? Or how could that possibly be more difficult for us depending upon how heightened depression is or what depression looks like on us individually? Now, often people will come in and will describe depression as just being this overwhelming mess that gets worse and worse. And because it feels so overwhelming, it can be really challenging to parse through what that actually looks like. What are those thoughts that contribute to our depression, our emotions, our physical experience, as well as the behaviors that we engage in? And it can be really challenging to step back and create more of a conceptualized idea of how each of those things go together and either make things worse for us or help us out. So, common symptoms of depression. This chart was taken from the Instagram site, What is Mental Illness? And this is just the tip of the iceberg for things. A lot of times people believe that depression is just being lazy or feeling sad, but it's so much more than that. And it's even beyond just what this next piece of the chart says. It's a loss of interest in daily activities, feeling more empathetic towards things, reduced appetite or increased appetite, weight changes, unexplained aches and pains, more of those physical symptoms, feeling of hopelessness, helplessness, guilt, some of those suicidal thoughts or homicidal thoughts or self-harming thoughts can come in there. Anger, irritability, there is certainly sadness, numbness overall, but just a generalized low mood. Sleep changes, either you're sleeping way too much, not getting enough sleep, loss of energy, self-loathing or self-deprecating thoughts, concentration problems, reckless behavior, and the list goes on and on. But as you can see, what most people think depression is so different than what it actually is. And if you asked each individual who experiences depression what it looks like, there will be similarities and there will also be vast differences. So one person might sleep a lot, one person might not sleep at all, or someone's sleep isn't impacted at all. So it is important that we just acknowledge how different it can look on each person and how even different bouts of depression might look a little bit different too. But certainly if you're experiencing any of those symptoms, that could be categorized as, something being related to depression. Now, as we continue to understand a bit more about our depressive experience, I like to utilize this strategy called the cognitive behavioral diamond. And what this essentially is it allows us to parse out, like, what are our thoughts related when we're feeling depressed? What do our thoughts sound like? What do our feelings feel like? What do our behaviors look like? And how do all those things go together and either hurt us or help us? Now, those symptoms of depression can bring about some pretty drastic changes to our life, to our daily routine, to our behaviors, and we often find that those behavioral changes is what makes the depression worse and can actually prevent us from coping effectively. So I do want you to think about it. How do your thoughts impact your feelings? And then how does that experience overall impact how you behave? If you want to take time to journal, you can certainly do that. Just press pause and record your responses. Otherwise, we'll just keep going. So we're going to break this down even further. If we really think about what I mean by this, I want us to think about a common symptom of depression being lowered energy and decreased motivation. So if someone's feeling really exhausted and not motivated, this might lead them to thinking and believing, okay, I need to cut back on my tasks and responsibilities so I have time to cope. Now, sometimes that might help us, and other times that might not. That might create a very slippery slope, which can lead to reduced social interaction, not completing our tasks on time, which can lead to thoughts of being ineffective. And as you can see, it's going to move very, very, very quickly. Now, when this cycle begins, this is what we call an example of a cycle of depression. So that low energy and fatigue can lead to decreased activity or the neglect of any responsibilities or social interactions. That can furthermore lead to increased feelings of guilt, hopelessness, overall ineffectiveness, really challenging thoughts and emotions. And as you can see, that's going to move really quickly, almost create this pinball effect that's going to perpetuate that depressive experience further. Now, to really help you understand what that looks like on you individually, I like to use this cross-sectional formulation model. This is taken from the Anxiety Toolbox workbook, which is a 3-week group workshop that we have offered at CAPS. But this certainly can just work so well into helping anybody understand their experience with mental health in general overall. And you can use this from, more of a strategic approach, like questioning when symptoms occur and what that situation was, those depressive triggers, or you can utilize this to just understand your experience with depression overall. But overall, this cross-sectional formulation diagram wants us to be able to just really question what's going on here. So if you do use it more strategically, really questioning the situation and that trigger, what was happening? Where were you? Who were you with? What did you feel anxious, depressed, overwhelmed, whatever have you about? Breaking down those physical symptoms. Are you experiencing physical anxiety? What else does depression feel like in your body? Are you tired? Are you unable to sleep? Are you sleeping too much? Are you unable to eat? What is that physical experience? Cognitively, really questioning what types of thoughts are coming up. Memories, maybe beliefs that you have about yourself or about a situation. Could be thoughts related to shoulds, like I should be better at this. I should be able to get this done. I should. Or, certainly other thoughts related, like hypercritical thoughts can come up there. But really questioning, when you're feeling more depressed, what thoughts are you getting tangled up in? Behaviorally, noticing what are things that you do when you're not depressed that you don't do when you are. Is there anything you're giving up, anything that you're avoiding? Some engagement in self-harm or substance use can certainly come up here, but really questioning how are you behaving when you're experiencing that bout of depression or feeling, more triggered in general. Emotionally, I do encourage you, this one can be hard, so pull up an emotion wheel. You can just Google search that. And there's lots of emotions that can come up here that's just beyond feeling numb or sad. You could feel angry, upset, frustrated, guilty, ashamed, dejected, rejected. The list goes on and on. But ultimately, we want to be able to really understand this because it's so individualized. And it can be helpful because it can, number one, help us identify our depressive triggers. Like what's triggering this response or making this more difficult? Two, we can understand how maybe we are responding to our depression in a way that's perpetuating that cycle, adding more distress than it is helping it. And it can also help us determine more helpful behaviors and thoughts. Like if we could intervene on this, what would we want to do different? Or which portion of this cross-sectional formulation diagram is causing more distress for you and less distress? So it just can really help increase our insight overall. If you do want to spend more time there, please feel free to pause the video, take a screenshot, journal, do whatever you need to, and certainly press play when you want to move on. So we're going to start off with some good journal questions. And as always, I do encourage you to participate in this fully. So journal, how does this cycle possibly perpetuate someone's experience with depression? And how do you think this cycle may start to move really quickly? Pause the video, record your responses, and when you're ready, you can press play and continue. The next set is, what are some examples of your depressive triggers? What is the biggest contributor to the cycle of depression for you? So what seems to be holding on the most? Is it the thoughts, the feelings, the behavior? What's causing the most distress for you? We know that they're all distressing, but what's causing the most distress? And what could be a more helpful thought or a more helpful behavior that might help slow down that cycle overall? Like if you could wave your magic wand and intervene somewhere and say, if I could change this, that would help me a lot. What would this be? Again, pause the video, take time to journal your responses, and when you're ready, you can press play and continue. So all of this really highlights the importance of basic self-care, and we're going to talk about each domain of basic self-care. But by understanding the way our cycle of depression contributes to our experience, we can gain valuable insight about where changes are necessary to be made, where we can start, with that magic wand sort of an approach and question, okay, if I could just do a little bit of this, if I could just ease my way in and make a tiny change, what would that be? Where can I integrate a basic self-care strategy in? Now, self-care is really a bit of a hot topic. It's something that's become very desensitized because everybody's talking about it like bubble baths and tea or, so on and so forth in this kind of sensationalized way. And because of that, you might find yourself having some limiting beliefs about what self-care is and what self-care isn't. Now, it is also important to mention that typical self-care strategies aren't integrated in very well in our cycles of depression. They're not often practiced. So we might not be focusing as much about integrating skills related to sleep, exercise, and nutrition. And finding ways to introduce this in can be radically helpful in alleviating or attempting to reduce some of the symptoms of depression in general. So if we think about sleep and depression, and we will have an excellent sleep video on our video library series as well. So I do encourage you to check that out if that's something that you're wanting to focus on entirely. But essentially, sleep and depression kind of go hand in hand. So there's a lot of neurotransmitters imbalances which can contribute to the depressive experience overall. And we also find that sleep is one of the most basic pillars of self-care. Now, I don't care what anybody says. If you read all of the studies, I do encourage you to spend some time looking at Dr. Matthew Walker. He is a sleep guru. The most optimal amount of sleep is 8 hours. There are very few individuals in this world who actually can function on less than that and function consistently on less than that. Now, some of us might need exactly 8. Some might need 7.5, or some might feel like they need 10. But again, according to Dr. Matthew Walker, there are very few humans who can actually function long-term on 6 or less hours of sleep. Now, in college, you might find yourself saying, yeah, I sleep great. I get 5 to 6 hours. I would just pause and encourage you to really question that. Similarly, in college, you might find it really common to pull all-nighters or have a more erratic sleep schedules. And again, these changes to sleep can have an impact on our functioning overall. Sleep deprivation can lead to decreased mood, decreased energy levels, difficulty with concentration, focus. So it can impact those neurotransmitters overall. And because we know that sleep can often be impacted by depression, finding ways to really focus on improving our sleep or our quality of sleep overall can be helpful in terms of working to cope with depression and integrate basic self-care in. So I want you to spend some time journaling. What do you notice about your mood, your energy, and concentration when you get optimal amounts of sleep? What about when you don't? And then what contributes to your more erratic sleep schedule? So think about when you are experiencing depression fully, what do you think contributes to that? And then maybe times when you're feeling less depressed, but you're still having an erratic sleep schedule, what contributes to that there? As always, please pause the video, record your responses, and when you're ready, press play and we can move on. The next portion of basic self-care is exercise and depression. And again, each of these are just going to start brushing the tip of the iceberg when it comes to these basic self-care strategies. So I encourage you, if you're finding any of these to be helpful, you're wanting more, seek out more of that resource, whether that's through other web workshop videos or through your individual work with your counselor, group therapy, so on and so forth. But the next pillar is exercise. Now, just like with sleep, research also suggests that exercise is an important strategy to combating against and reducing symptoms of depression. Now, you all hear people say exercise increases endorphins in your brain, and that is true. Exercise can help improve your neural pathways, which promotes brain growth. And brain growth is often usually stunted when an individual is experiencing depression overall. Those neurotransmitters aren't firing in the way that we need them to. And so we want brain growth to essentially help us improve our neurotransmitter imbalance and increase those happy neurotransmitters, the dopamine, the serotonin, the norepinephrine, the endorphins, everything like that. So it is important to recognize how engaging and moving in our body in some capacity, and I say that in some capacity, can be helpful. It might not be realistic for you to work out or exercise in the way that you would like to, because of all those other symptoms, but that's where we want to challenge that all or nothing mindset and question, how can I still exercise, promote that brain growth in some way if I can't maybe even do it in that exact way I'm wanting to? So again, in short, exercise releases those endorphins, and those endorphins are powerful chemicals in your brain that can ultimately help improve your mood, your energy, and your concentration levels over time. So that over time, that consistent integration of exercise can promote long-term changes to the brain. So I just want you to think about it. And if you want to spend more time and journal it, feel free. But what do you notice about your mood and overall being after you move your body? Are there any changes? Maybe it's not drastic, but are there any slight changes that happen? How do you feel? How do you think? How does your body feel? What is that experience overall? So spend some time and journal. What do you notice about your mood, energy, and concentration when you're moving your body? What about when you don't? And what makes it difficult to integrate exercise in your life now, or typically when you're feeling more depressed or more anxious, and what could make that easier? Is it about making adjustments to the type of exercise, to the length of time you do it, to when you do it? What could make it easier for you to integrate it in? Take some time, journal your responses, and when you're ready, press play and we can continue. The last pillar is nutrition in depression, and I will say this, recommendations on appropriate nutrition is outside the scope of my practice or any of our clinical practices at CAPS, or outside the practice of this workshop series. So I do encourage you to consider other ways that your nutrition and eating habits might impact your depressive experience, and certainly seek out additional resources to get more information on that from an individual who has that within the scope of their practice. So we do have dietitians and nutritionists with the health and wellness department at the IU Student Health Center, and you are able to call the General Student Health Center line to schedule that appointment with them if you would like to be able to dive in deeper and talk more about nutritional changes that could be made. But again, we do know that nutrition is a primary pillar of self-care, and when individuals experience depression, there are changes to their appetites. There are changes to what they eat, how they eat, when they eat. And we do want to question individually through our work with our counselor and a work with a nutritionist or dietitian, how changes to our diet can impact our mood overall and ways in which we can make changes that could help us. Now, I have this self-care pie chart, and I have not found one that I found to be perfect and just the best representation of basic self-care, but I thought this one was pretty good. And you can certainly expand on this, but there is basic self-care of the nutrition, the sleep, the exercise, and we find sleep on here, moving the body, healthy eating, but then there's also other ones like fresh air, reflecting on those thoughts and emotions. And if you want to dive into that deeper, again, we have other web workshop series that does that great. Doing what you love. I know certainly when we're feeling more depressed, we can experience some feelings of apathy, so that might be hard. So it might just be, can I do something that I know would typically give myself joy? Can I do something to just take care of me? Meditation or mindfulness experiences. There's lots of different things that we can do, but we do want to question how when we're in that cycle of depression, engaging in these basic self-care strategies can be made difficult, and where can we find an opening to begin integrating some of this in a more basic way. So I want you to take some time and journal. What would it be like for you to identify a basic self-care plan for the rest of this week? And if you were going to attempt to integrate one basic self-care strategy, again, nutrition, sleep, exercise, what strategy or skill would you choose? And get specific about this. So it might be, I'm going to go for a 30-minute walk 2 times this week. Or I'm going to do jumping jacks when I watch TV. Or I'm going to make it a goal to go to bed 1 hour earlier. Or whatever have you. So get specific with what that basic self-care strategy is and what that's going to look like. Take your time, journal your responses, and when you're ready, you can press play and we'll continue. Now, this next portion, these are screenshots that are taken directly from one of the workbooks from our 3-week Getting Unstuck depression-related group workshop. So if you're really enjoying these, we do have a 3-week group that dives in a bit deeper to it that I do encourage you to talk with a clinician about being able to join. But it's really looking at this, and I encourage you, take screenshots if you'd like to, pause the video to record, but looking at it and questioning it in each individual domain. What is one sleep hygiene strategy that you can implement or have available to you throughout the week? What is one exercise strategy that you can implement or have available to you? What is one nutritional strategy? So really break them down. It's important that we do that because we can just often sit here and think, okay, I need to get more sleep. Well, I want us to break that down and question, why is that difficult? What could make that easier? What do I need to rely on? What does a sleep strategy look like? Really breaking that down and getting specific can be far more helpful than just kind of having these looming, generalized, vague thoughts in our head, just kind of looming overall. So I do encourage you, think about breaking that down further and creating that weekly self-care plan. And then questioning, if you implement your plan, how might you feel? How might this impact things for you? What do you expect to have happen? Now, again, it's probably not realistic that integrating these basic strategies in is going to go from 0 to 60. You're going to go from depressed to not depressed. You know, we want to be careful of that all or nothing mindset, but how might that impact things just a little bit for you? And what impact might this self-care plan have on your world outlook and your sense of self? How might that change things for you? How might that help slow down that cycle that we talked about at the beginning of this workshop? Again, feel free to think about that, journal that, take screenshots, pause the video, do whatever you need, but I do want you to consider how you can continue to apply these strategies and what was discussed today in a self-care plan for the rest of the week. Now, if you're finding this to be helpful and you're wanting to continue to expand on your knowledge, there are plenty of resources at CAPS that I'll talk about, including free workshops like this or individualized services as well. But it is important that we understand how to determine if additional services are needed. A great way to tell that is, number one, paying attention to any increases in other mental health symptoms, depression, anxiety, trauma, stress, so on and so forth. Changes in our personal functioning, so changes to our sleep, our appetite, our hygiene. Reduced academic or social functioning, not going to class. Maybe we are going to class, but we're participating differently. Any changes in our engagement in our social relationships, with work, so on and so forth. And of course, any thoughts of suicide, harm to others, or self-harm, those are all indicators that we would want to seek additional services. Now, I'm just going to briefly touch on the different services that are offered at CAPS. And let me say this, it is robust. We have a lot of services that are available to you. And so if you're feeling overwhelmed, please know it is not on you to have to come in to your appointment and know exactly what you're needing. If you do, great. If you don't, that's okay too. Ultimately, you're able to make a very first 30-minute appointment where you and a counselor are going to talk through what's coming up for you, and they can make some recommendations on what they think could be best. Now, I'm still going to talk about those resources just so you have an idea of how robust those services are. We offer individual, couples, and group counseling. In light of COVID-19, everything for the most part will be remote, so offered via phone or video, but I encourage you, please check our website for the most up-to-date information. If there's not a global pandemic going on, we do offer telehealth still, in addition to in-person services. We have an after-hours crisis line and emergency appointments available, and you're able to access that the same way. You call 812-855-5711. After hours, you select option 1. So at 2 in the morning, if you're having a crisis, you can call that number, or you can seek out 911 or your local emergency room or other crisis contacts too. If it's during the weekday, Monday through Friday, 8 until 4:30 p.m., you call that same line and they will connect you for a telehealth appointment with someone. Or again, if we're open for in-person appointments, you're able during those hours to show right up to the 4th floor, say you'd like an emergency appointment, and you'll be seen relatively quickly. We have free drop-in appointments through our Let's Talk Now service options, which will be discussed later. Again, emergencies are always best served by calling us, or if we have walk-in services open, going to an emergency walk-in appointment. Those free drop-in appointments are not going to be best for emergencies. We have sexual assault crisis counseling services and other free workshops just like this, or a mindfulness workshop. But again, please always visit our website for the most up-to-date list of resources that we have, as we are always making adjustments depending upon what's happening in the world and what we're seeing our students are needing. Now, the Let's Talk Now program is our multicultural outreach program, and it's geared at being able to serve our traditionally underserved students. Let's Talk Now during typical years, what that is we have a list of different sites where we have various clinicians go to during specified hours and days of the week. So during typical times, you would be able to Google search that, see where someone's located, and if it's not an emergency, but you're wanting to talk with someone relatively quickly, you can show right up, sit down, and start talking immediately. Now, because of COVID-19, the global pandemic, I do encourage you to visit that website to see how this is being impacted by things overall. And again, for the most up-to-date information, the website is always the best place to go. Let's Keep Talking is our formal counseling services. And again, this is served at really finding ways to target and serve our more traditionally underserved students. So we have counselors located at various culture centers on campus: Asian Culture Center, La Casa, Neil Marshall Group Scholars, DEMA, OIS, so on and so forth. Again, please visit our website to see how things are impacted depending upon where we're at in this semester, what's happening in the world. But this will allow you to see an individual either at that location, or if you're receiving telehealth, you're seeing the counselor who would be typically working at that location. You're able to call CAPS to schedule that appointment, and as always, please visit our website for the most up-to-date information. And last but not least, for CAPS resources, we have our SACS team, our Sexual Assault Crisis Services team. This is staffed by counselors who work for CAPS, but they are trauma-informed and specially trained in working with individuals who have experienced sexual assault or sexual violence. So if you've experienced any of what's listed after that first point on this slide, if you experience anything like that and you feel like it would be helpful for you to talk through some of those things, SACS might be a great option for you to go. These services include individual, couples, group counseling, support groups, psychiatry care, information and assistance with medical, judicial, or legal issues, and they also have their own after-hours crisis line. Please note this crisis line is different than the one for CAPS. The number is 812-855-8900, and these services are available for all genders and all identities. But as always, if you're unsure of what might feel like it's going to be the best fit, that initial 30-minute appointment with that counselor is going to be a great starting place for you to be able to begin working through and parsing out what resources might be most helpful for you. And last but not least, a service that's actually not within CAPS is called the Center for Human Growth. This is another counseling service on IU Bloomington's campus. So if you're just wanting to explore the various options you have, I encourage you to look into the Center for Human Growth, or as we call it, the CHG. You're able to visit their website or give them a call, see how their services are changing due to, the time of the semester, COVID-19, or whatever else. And so I do encourage you to explore that as a resource as well. And that is all that we have for today's presentation. Certainly, please continue to explore other videos within the video library. Log on to a live version of this. Give us a call if you want to explore other resources. I just really encourage you to continue to expand beyond the work that you did today. And feel free to redo this video if you think you might get something out of that too. That is all that I have for you today. If you need anything else, please call us at 812-855-5711.